Hello, my name is Emma Mitchell, and I'm an associate professor at the University of Virginia School of Nursing. My project today is called The Ethical Considerations for Applications of Artificial Intelligence in Cervical Cancer Screening and Prevention, Nursing Implications. I'm a public health nurse researcher and excited to speak with you today as part of my Cohort A North American Leadership Journey. Cervical cancer is a cancer of disparities. We have wonderful tools to prevent it and great resources to detect it early. However, as seen here in our incidence and mortality maps, we have persistent disease in areas of limited resources. In 2021, the World Health Organization committed to a strategy of cervical cancer elimination in the next 100 years, with commitments from member states by 2030 to a 90-70-90 plan, where 90% of girls would be vaccinated by age 15, 70% of women would have access to a high quality screen by 35 years of age, and ideally again by age 45, and 90% of women determined to need treatment would be followed up with and have access to treatment. So in that context, my project purpose was to explore ethical considerations of emerging technologies in order to meet that call. Specifically, I was interested to look into tools of artificial intelligence or that incorporated a machine-based learning algorithm and have special emphasis on what those implications were for nursing. To begin, we started with a scoping review of the literature. We focused on Latin America and the Caribbean as a geographic area to dig into the evidence that supported that World Health Organization strategy. And so we learned a lot about what research had gone on in this geographic area specific to technologic innovation and implementation that allowed for this strategy to be launched. We had representation in our findings from 22 countries, representative of languages English, Spanish, and Portuguese publications. And of the technology that's been published about in this geographic region over the past 10 years, of the 180 articles or so that we included, the majority recently, as well as the majority overall, surrounded HPV-based primary screening, where we're actually looking for the presence of high-risk genotypes of cervical cancer high-risk genotypes of human papillomavirus known to cause cervical cancer. Here's a small representation of 10 of the 22 countries that are represented in the literature. You can see here from reviewing the international cancer plans that these countries have a national screening program. Many are still based on cytology, though you can see this is dated from 2021, and so increasingly we're seeing in this geographic region HPV testing being incorporated. Our policy analysis continued to look at screening coverage. So when we look at the percentage of eligible women who have been screened within the past 5 years, you can see that represented as well as the percentage of women receiving a lifetime screen. So we see variability in this geographic area. So what does this mean for AI or machine-based learning? For cervical cancer, one of the promises of AI is in point-of-care diagnostics. And so can we, at the point of care, provide a diagnosis and very rapid treatment? The World Health Organization recommends a screen and treat model where we identify cases or early detect precancerous lesions, intervene immediately, and that's going to lead to our best outcomes. So that is one of the main promises of AI in cervical cancer prevention. But as we look to the literature and where the state of the science is, it's very much in vitro testing, pilot testing, and beginning of implementation of testing. And so concurrently to that technologic advancement, the purpose of my project was really to advocate for interprofessional and ethical guidelines to guide rollout, implementation, and testing of this technology in the context of the elimination strategy. I learned about ethical frameworks through a parallel process with global lactation and breastfeeding research guidelines and a process that was developed linked here. But next steps, we're really going to try to share our findings with key stakeholders. So we're going to be presenting our scoping review findings with nursing-specific analyses at the International Council of Nurses this summer. Under review at the International Cancer Screening Network is our larger scoping review and findings. We'd like to speak with leaders in AI and machine-based learning, particularly point-of-care diagnostics, whether it's about cervical cancer or other types of cancer. And we'll be ongoing trying to incorporate the voices of and advocate for the agency of nurses in those resource-limited settings where this technology will likely be trialed and have the most promise. And so engaging with nurses in those settings is really important. It's been a wonderful journey in learning about leadership styles. The emphasis on authentic leadership has really underpinned my passion and purpose in this project. And really, of the four tenets of leadership we've learned about, the inclusive piece is the most important. I'm really committed to involving nurses on the front lines, nurses in low resource settings who are going to be able to benefit in some ways the most from the promise of what artificial intelligence and machine-based learning can do in cervical cancer prevention. So thank you so much. Thank you to WomenLift, and thank you to all of my wonderful colleagues in our cohort and beyond.